telling you, man, the numbers from this latest survey are pretty troubling, especially the depression numbers seem to be going through the roof. Why? What did you find, and why is this?
Yes, certainly we have a mental health crisis in America, and through Linda and I, our work, professional work, we've seen this and known this for a while. And I've been recently traveling across the country establishing clinics, the Cohen Military Family Clinics. And through this journey, I've had a chance to talk with family members or patients and hear what they have to say. And frankly, they're having a hard time finding care when they need it, and they can't afford it many times.
Yeah.
The second thing is, providers, they're burnt out, they have high caseloads, and then the CEOs who run in these community mental health centers are struggling to keep their doors open with the low reimbursement rates, the high demand. And so, we really have a challenge across America, and Linda and I wanted to know more about it. So that's why we commissioned this 5,000 respondent survey to hear firsthand the attitudes around mental health and then the issues around access to mental health. Linda?
And we got some good news. The good news is there's less stigma. That was the major barrier just a few years ago. It's no longer number one. 6 out of every 10 Americans has looked for help for themselves or a loved one. 76% of all Americans understand that mental health is as important as physical health. But the number one issue is cost and where to go to get help. That's what we need to tackle now.
Absolutely. It seems to be the major thing when it comes to healthcare in this country. The stigma, though, I have noticed has definitely been being chipped away. You're seeing more and more people in the public eye, more celebrities coming out and sharing their mental health issues as well, which is helps break down barriers. Who's typically affected by mental illnesses? This really covers the gamut, doesn't it?
Oh, absolutely. In my work, particularly around veterans, I'm really happy to see that more veterans are coming forward to get care. Their family members are getting care. We are chipping away at mental health, and it starts with leadership. It starts with community figures, personalities that can really help change this, and we're seeing that. But I think the bottom line here that we're challenged with is that when you do raise your hand and ask for help, can you get it? And so this is what we need to talk more about, and we need to create systems that can really enable and support getting care when you need it.
And we have some solutions to that. We have a mental health first aid program in this country where in local communities people can take a course, learn how to help each other, and also where they can go when they do need professional help. We have the Stephen Cohen clinics, which is a model for philanthropy.
Yeah, Mr. Cohen put up $275 million to open these clinics to do just what we're talking about, reduce barriers to care. Free, accessible, quality care in a clinic via telehealth. So with Mr. Cohen's financial support, our military family clinics across the country can do all of this and thrive because they're made whole financially, whereas community mental health centers sometimes are left in the deficit.
And we're trying to solve that by creating certified community behavioral health clinics in every state and in every community so they can recruit staff that is available to treat the people they serve, and also buy the technology that the Cohen Clinic is buying to do telehealth, to do remote treatment, particularly in rural areas or areas where people have trouble. We're also trying to change how clinics operate so people can get help the same day they need it, just like we have urgent care clinics on every corner now in America. So things are underway. We just need people to understand that and to demand that their insurance covers mental health services the way they do physical health.
Absolutely. Luckily, that telehealth technology can really help on the mental side of things. You don't necessarily have to open your mouth and say, that doesn't necessarily get to the heart of the matter there. It's great work that you guys are doing, and keep it up. We're hoping to see the next survey has better numbers for everybody.
Thank you.
All right. For more information.
Thank you. And for more information, you can go to
CohenVeteransNetwork.org
or thenationalcouncil.org.
You said it better than I could have ever. Thank you so much. It's great having you guys. Cohen's Veterans Network, they're a proud sponsor of the Morning Blend. The websites are right there at the bottom of your screen.